Fenoglide, also known as fenofibrate, is a medication that is used in combination with a proper diet to help lower bad cholesterol and fats, such as LDL and triglycerides, while also raising good cholesterol, known as HDL, in the blood. It does so by increasing the natural substance in the body that breaks down fats in the blood. This medication belongs to a group of drugs known as fibrates. Lowering triglycerides in individuals with very high levels of triglycerides in the blood may reduce the risk of pancreas disease, also known as pancreatitis. However, it's important to note that fenofibrate might not lower the risk of a heart attack or stroke. Always consult with your doctor about the potential risks and benefits of taking fenofibrate. In addition to maintaining a proper diet, such as a low cholesterol/low-fat diet, there are other lifestyle changes that can help fenofibrate work more effectively. These include regular exercise, weight loss if overweight, and quitting smoking. It's always best to consult with your doctor for more specific details on how to incorporate these lifestyle changes while taking fenofibrate. As for the daily dosage and optimal timing, it's important to follow your doctor's recommendations. This may vary depending on your individual health condition and needs. Always take fenofibrate as prescribed by your doctor and at the recommended times. When taking Fenoglide, it's important to follow your doctor's instructions and take it by mouth once daily. There are different types of capsules and tablets, so make sure to use the specific type prescribed by your doctor. Some forms should be taken with food, while others can be taken with or without food. Your pharmacist can provide more information about your specific brand of fenofibrate. The dosage will depend on your medical condition and how you respond to the treatment. If you're also taking other medications to lower your cholesterol, make sure to take fenofibrate at least 1 hour before or 4 to 6 hours after those medications to ensure proper absorption. It's important to take this medication regularly at the same time each day to get the most benefit from it. Don't increase your dose or use it more often than prescribed. Even if you feel well, continue taking this medication as directed. It's also crucial to follow your doctor's advice about diet and exercise, as it may take up to 2 months to see the full benefit of Fenoglide. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential risks. Most people who use this medication do not experience serious side effects, but it's important to be aware of the following potential issues. Fenoglide may rarely cause gallstones, liver problems, and muscle problems. If you experience nausea/vomiting that doesn't stop, loss of appetite, stomach/abdominal pain, yellowing eyes/skin, dark urine, muscle pain/tenderness/weakness, or signs of kidney problems, it's important to contact your doctor right away. In some cases, this medication can cause a severe lowering of HDL, good cholesterol, levels, so it's important to have your HDL cholesterol levels checked regularly and attend all of your lab appointments. Additionally, if you notice easy bleeding/bruising, unusual tiredness, chest pain, sudden pain/swelling in the leg, signs of infection, or symptoms of a serious allergic reaction such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. If you experience any side effects not listed here, be sure to speak with your doctor or pharmacist. Remember, it's important to report any side effects to your doctor or the appropriate medical authority. Before taking fenofibrate, it's important to let your doctor or pharmacist know if you have any allergies, especially to other fibrates, or if you have any other allergies. This medication may contain inactive ingredients that could cause allergic reactions, so it's essential to talk to your pharmacist for more details. Before using this medication, be sure to inform your doctor or pharmacist about your medical history, especially if you have kidney disease, gallbladder disease, liver disease, or if you consume alcohol. If you are planning to have surgery, it's crucial to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, you should only use this medication when it is clearly needed. It's important to discuss the risks and benefits with your doctor. It is not known if this medication passes into breast milk, so it's not recommended to breastfeed while using this drug and for 5 days after stopping the drug. Be sure to consult your doctor before breastfeeding. In terms of daily dosage, it is best to take fenofibrate as prescribed by your doctor. The optimal timing for taking this medication usually involves taking it with food to help maximize its absorption. Be sure to follow your doctor's instructions for the best results. Now let's talk about how to use Fenoglide. It's important to be aware of any drug interactions that may occur when taking Fenoglide. Certain medications can change how Fenoglide works or increase the risk of serious side effects. It's a good idea to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. You should always consult your doctor before starting, stopping, or changing the dosage of any medicines. One specific product that may interact with Fenoglide is blood thinners such as warfarin. It's important to be cautious when taking these medications together. It's also worth noting that fenofibrate is very similar to fenofibric acid, so it's important not to use medications containing fenofibric acid while taking Fenoglide. In terms of optimal timing, it's generally recommended to take Fenoglide with food, either once daily or as directed by your doctor. Be sure to follow your doctor's instructions carefully and take the medication at the same time each day to get the most benefit from it. If someone has taken too much Fenoglide and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important not to share Fenoglide with others. While taking this medication, it's crucial to have regular medical tests done to monitor your cholesterol and triglyceride levels, as well as your kidney and liver function. Make sure to keep all of your medical and lab appointments, and consult your doctor for more details. If you happen to forget to take a dose of Fenoglide, take it as soon as you remember. However, if it is close to the time of your next scheduled dose, it is better to just skip the missed dose and continue with your regular dosing schedule. It's important not to take a double dose to make up for the missed one. Just take your next dose at the usual time. And always remember to follow the instructions provided by your healthcare professional. When it comes to storing Fenoglide, it's important to keep it at room temperature away from light and moisture. Different brands of this medication may have different storage requirements, so be sure to check the product package or ask your pharmacist for specific instructions. It's also important to keep all medications out of reach of children and pets. When it comes to getting rid of any expired or unused Fenoglide, it's best to consult your pharmacist or local waste disposal company rather than flushing it down the toilet or pouring it into a drain. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.